It sounds like something from a school playground joke, doesn't it? The idea of butt breathing. But what if I told you that this rather unusual concept is now at the forefront of serious medical research? Scientists are exploring a groundbreaking method that could one day save the lives of people who are unable to breathe properly. This technique, officially known as enteral ventilation, bypasses the lungs entirely. Instead, it uses the other end of our digestive system, the rectum, to deliver life-sustaining oxygen directly into the bloodstream. It's a radical idea, but one born from clever observations of the natural world and cutting-edge science. So how on earth does it work? Imagine a person whose lungs are so damaged by illness or injury that they can no longer pull in enough oxygen. A mechanical ventilator is often the only option, but these machines are complex and not always available. This new method offers a simpler alternative. It involves introducing a special, oxygen-rich liquid into the large intestine using a procedure that is very similar to an enema. The lining of our gut is filled with a rich network of blood vessels, and the theory is that these vessels can absorb the oxygen from the liquid, just as our lungs absorb it from the air. This process relies on a remarkable substance called a perfluorocarbon. This is a synthetic liquid that has an incredible ability to dissolve and carry huge amounts of gas, including oxygen. Think of it as a supercharged delivery truck for oxygen molecules. Once this oxygen-loaded liquid is gently introduced into the rectum, it sits against the intestinal walls. The oxygen then naturally moves from the liquid, where it is highly concentrated, across the thin gut lining and straight into the waiting blood vessels. From there, the newly oxygenated blood circulates throughout the body, supplying vital organs just as it would if the oxygen had come from the lungs. The real beauty of this approach lies in its potential simplicity and accessibility. In a crisis, when a patient's airway is blocked or their lungs have failed due to severe pneumonia or a virus like COVID-19, this could be a game changer. It offers a completely different route for oxygen to enter the body, one that circumvents the primary problem area entirely. It's an ingenious workaround that could provide a crucial lifeline when conventional methods are failing or simply not an option. This is not science fiction. It is a tangible possibility that is being rigorously tested right now. The inspiration for this medical innovation didn't come from a high-tech laboratory, but from the muddy bottom of a pond. Scientists observe certain aquatic animals, like the humble loachfish, that have a fascinating survival trick. When the water they live in becomes low in oxygen, these fish can swim to the surface, gulp air, and absorb the oxygen through their intestines. This ability, known as aquatic intestinal respiration, allows them to survive in conditions that would be fatal for other fish. This natural phenomenon sparked a brilliant question among researchers. Could mammals, including humans, possess a similar, albeit latent, ability? The journey from observing fish to testing in mammals began a few years ago. In 2021, researchers decided to see if they could replicate this effect in animals more biologically similar to us, like pigs. They found that by delivering oxygen, either as a gas or dissolved in a liquid, into the rectum of the animals, they could successfully raise the oxygen levels in their blood. These experiments provided the crucial proof of concept. They demonstrated that the mammalian intestine was indeed capable of absorbing oxygen and that this could be a viable way to support the body during respiratory distress. The animal trials were a resounding success, paving the way for the next bold step. Of course, you can't just pump air into the intestine, you need a safe and effective carrier. This is where the perfluorocarbon liquid comes in. These liquids, which include substances like perfluorodecaline, were developed decades ago and have been explored for various medical uses, including as a type of liquid ventilation for the lungs. They are incredibly dense and can hold far more oxygen than water or blood plasma. Furthermore, they are biologically inert, meaning they don't typically react with the body's tissues. This combination of high oxygen capacity and safety made them the perfect candidate for this new rectal delivery method. With promising animal data and the right delivery liquid identified, the stage was set for the ultimate test, a human clinical trial. The goal was to see if this procedure, which had worked in pigs and was inspired by fish, could be safely performed on people. The research, led by the dedicated team of Dr. Takanori Takebe at the University of Osaka in Japan, moved from the realm of theoretical science to practical human application. The world watched with keen interest as they prepared to find out if butt breathing was a viable medical procedure or simply a scientific curiosity. In October 2025, the scientific community received the news it had been waiting for. The results of the very first human trial of enteral ventilation were published in the prestigious journal Meidi. The study was conducted in Japan, and its primary objective was not to see if the method worked to oxygenate the blood, but to determine if it was safe and tolerable for humans. This is a critical first step in any new medical procedure. Before you can prove something is effective, you must first prove that it does no harm. The trial was meticulously designed to answer this fundamental question of safety. The study involved 27 healthy male volunteers who bravely signed up for this unconventional experiment. The participants were administered varying volumes of the perfluorocarbon liquid rectally. The amounts ranged up to 1,500 milliliters, which is about the size of a large bottle of water. They were then asked to hold the liquid inside for a full hour. It's important to note that for this initial safety trial, the liquid was not oxygenated. The focus was purely on how the body would react to the presence of the fluid itself within the large intestine, a place it is not normally found. The results were overwhelmingly positive. The researchers found that the procedure was generally safe and well tolerated by the volunteers. As you might expect, some of the participants who received the largest volumes of liquid reported feelings of abdominal bloating and some mild discomfort. However, these sensations were temporary, and crucially, no serious adverse events were recorded throughout the entire trial. In a testament to its tolerability, an impressive 20 out of the 27 participants were able to comfortably retain the liquid for the entire 60-minute duration, showing that the procedure is indeed feasible for most people. This successful safety trial is a monumental achievement. It has officially moved the concept of butt breathing from the realm of satirical awards. It won an Ig Nobel Prize in 2024 for its unusual premise, to that of serious medical consideration. By establishing a strong safety profile, the Japanese research team has laid the essential groundwork for the next phase of investigation. They have opened the door for future studies that will finally measure just how effective this method can be at delivering life-saving oxygen to patients in desperate need. Now that the initial safety hurdles have been cleared, the path forward for enteral ventilation research is becoming much clearer. Dr. Takanori Takebe and his team have already announced their next objective, which is the trial everyone is truly waiting for. The next study will involve using perfluorocarbon liquid that has been fully saturated with oxygen. The primary goal will be to measure efficacy. How effectively and how quickly can this method raise the oxygen levels in a person's bloodstream? This will be the true test of whether butt breathing can function as a life-saving intervention. The potential implications of this research are immense, particularly for emergency medicine and critical care. If proven effective, enteral ventilation could become an invaluable tool for paramedics and doctors treating patients with severe respiratory failure. This could be due to physical trauma that blocks the airway, advanced lung diseases like pneumonia, or the devastating effects of a pandemic virus. In situations where traditional ventilators are scarce or cannot be used, this low-tech, relatively simple procedure could be deployed quickly to buy precious time and keep a patient's vital organs supplied with oxygen. This method could be especially transformative in remote or low-resource settings. Mechanical ventilators are expensive, require a stable electricity supply, and need highly trained staff to operate. In contrast, enteral ventilation could theoretically be administered with much simpler equipment, essentially just a bag of oxygenated liquid and a catheter. This could democratize access to respiratory support, bringing a life-saving capability to parts of the world where advanced medical infrastructure is lacking. It represents a potential shift towards more resilient and accessible medical solutions. In conclusion, While the name butt breathing may continue to raise a few eyebrows, the science behind it is robust and its potential is profound. What began with observing a peculiar fish has evolved through successful animal studies and has now passed its first critical test in humans. This research stands as a powerful example of how looking to nature can inspire medical breakthroughs. The next trials will determine its true effectiveness, but we are potentially on the cusp of a new era in respiratory support, one that could offer a new form of hope for the most critically ill patients.